Okay, I think we're live now. So welcome everybody, good afternoon, and welcome to our live Q&A on the COVID-19 vaccine. I have a number of doctors and other health professionals with me today that I will be bringing on screen in just a moment. But I am your host, Jordan Kreiderman, and I am part of the communications department at Carey Scanning Family Services. Today I'm located on the beautiful unceded territory of the Clayton, and I invite you to reflect on the land you are presently on and the gratitude we share for the lands that sustain us all. So we'd also like to thank Sycus First Nation, Northern Health Authority, and the First Nations Health Authority for helping us organize this call. And thank you for everyone that is joining our live Q&A today. We will answer all the questions that we can and hear from the doctors and other health professionals that we have today. So joining us today is Dr. Rakel Kling from Northern Health, Trish Howard from the First Nations Health Authority, and we have Beverly Selle, sorry if I mispronounced that, and Dr. John from CSFS. And we also have Mick Harper, who is with the comms department, who is invisible. He will be monitoring all of our questions and forwarding them on to us. And so welcome all to everybody that is here. And so we'll be answering some questions previously submitted to us on our social media posts that you might have saw over the night. But for anyone that's that's watching now, feel free to put your comments in the live stream and we will try to get to them as best we can. If we don't get to them though, feel free to email us at communications@csfs.org and we will try and get to them best we can. But without further ado, you will not see me anymore. I'm going to bring on the professionals and they will get to your questions here. You're good to go. Can we see everyone? Hopefully. Alrighty, can everybody hear me?
Yeah, we can hear you, Jordan.
Alrighty, perfect. So if we want to just quickly do a short introduction with everybody and then we'll get going with some questions. Whoever wants to go first.
Hi there, everybody. It's Dr. John Pawlovich here. I'm the medical director for Carey Scanning Family Services, calling in from the traditional territory of the Stolo Nation.
Perfect. And next?
Hi, it's Rakel Kling. I'm one of the medical health officers with Northern Health, and I do apologize. I can only stay until 2 o'clock today.
All good. We're going to try and keep this as short as we can for about 20 minutes, so that's perfect.
Thank you. Good afternoon, everyone. It's Trish Howard, Regional Manager of Primary Care with the First Nations Health Authority.
And Beverly.
Nurse Manager for FNHA, Northern Region, supporting community employed staff. Thank you.
Excellent, thank you. So our first question is from Verge Patrick. They ask, does the vaccine make you immune to COVID-19? And can you still get COVID-19 and pass it on to other people? So whoever wants to, whoever wants to jump in.
Yeah, so what the vaccine does is what it will work most well at, what I understand, is that it works really well at preventing very severe disease and preventing some symptoms. But it's not going to, it might not prevent you entirely from getting the disease, and it's not, we don't know yet if it prevents people from passing the disease on to others. At this time, we don't think it does prevent you from passing on COVID to other people right now.
Okay, so that's something that will come on later on. Oh, Dr. John?
Yeah, I would just add to that. So we know that the vaccine does an amazing job at helping people create immunity, and essentially what's important to understand is that what the vaccine is not is live vaccine or parts of live vaccine. That's not what you're getting when you get the vaccine. In fact, the vaccine is just provides some material for your body to make a protein that is part of the COVID virus, so your body can create an army, if you will, to fend off against COVID. So think of the vaccine as creating an army within all of us to fight the vaccine, because that's what it does. the second part to the question, can you still get COVID when you get the vaccine?
Mhm.
The answer is you can, but it's unlikely. And even if you do, you're most likely going to get a very mild version of the illness. And so that's another really important part to understand. The other part I would add is the last part is that in the medical trials with the vaccine, of the over 30,000 people who got the vaccine, no one died of COVID. And so that's a really important bit of information for everybody to appreciate.
Okay. Yeah, that actually kind of leads into another question of ours, that there are some rumors that there was a potential fatality. Mind you, this was in the USA, so who knows, that somebody died from the vaccine in the USA. I don't know if anybody has information on that.
So I can say, so the physician in that I think you're alluding to, Jordan, I think it was in Florida. The person died of an illness that was many days after the vaccine. The question is whether there's any link to the vaccine. There's absolutely no conclusive evidence that that there is. So and in fact, people get ill and die from many things all the time, and sometimes the relationship between when somebody gets a treatment like a vaccine and then an illness or death happens, sometimes people can make that, draw a conclusion between the two. But as far as we know, there's no definitive evidence at all that the two are linked.
Okay. That's great. So Norman Charlie is asking, what is in the vaccine? So I guess, how is it developed as well?
Well, I think I'll go back to what I said a little bit earlier. The vaccine is basically information that tells your body to make a protein that's on the so in technical terms we call it mRNA vaccine, but that's just a fancy kind of medical term. I think it's more helpful for people to understand what it is not. And I said before, it's not live vaccine. It's not live vaccine in any way. And so previous vaccines, we know, like measles, for example, had bits of live vaccine in them. This is not that vaccine. This is quite different technology. And really it's essentially like a computer program for your body that allows it to make a certain part of the virus molecule, the spike protein, the one that we've seen on the news, on commercials, in the stores, and on the side of a bus. And that's what helps your body make its army against, okay? And it creates that army in your body that then fights COVID should it arrive inside you.
Gotcha. Okay. So it's kind of, is that sort of different from the flu shot then, or is it kind of the same thing?
I'll let Rakel answer. So
it's a bit different than the flu shot, but like Dr. John said, just the general background and mechanisms and how it works, it's not so different from the usual flu shot. Yeah, it presents something for the body to remember as something that needs to be fought off in the future, and then that's what happens with this vaccine. It just provides a trigger for our body to remember that this is not something we want in our body and to fight it off. And that's very similar to how the flu shot works as well.
Okay. And another common question that we've seen from a number of people is this vaccine safe for people that are immunocompromised?
And I can answer that as well. Whether you're immune compromised, whether you have a heart condition, whether you have lung disease, kidney disease, diabetes, the vaccine is as safe as vaccines come. It's extremely, extremely safe. And the reason it's safe is because it doesn't have live vaccine in it. I think that's a really, really important concept. We know that probably the thing that we have to be mindful the most are people who have histories of severe allergies, specifically to components that are in the vaccine. those are very, very small number of people, and in those people, one needs to be very cautious. But in terms of the safety of the vaccine, it's incredibly safe. The really, you know, within the immunocompromised patient population that you just asked the question, Jordan, it's really not the safety of the vaccine that's the question. The question that we talk about is whether those people will create an immune response. They'll make their army will grow to the level that we want it to grow to inside them to fight COVID should it come. That's the question. Okay. And so I hope that's helpful, kind of describing it that way.
Okay, yeah, definitely. Do you want to add anything, Rakel?
I guess I would just add that for those that are very severely immunocompromised, so not like Dr. John said, not just those with, you know, diabetes, heart disease, but those that are on like chemotherapy or, you know, significant amount of steroids, might be a good opportunity to have a conversation with your primary care provider about whether the vaccine is right for you at this time.
Okay.
And Jordan, having said that, and that's a really good point, and talking with healthcare providers is always the right thing to do for sure. But just understanding for everyone, but those people are incredibly susceptible to COVID. And so if you're immunocompromised, if you're on those medications, you're very, very vulnerable to COVID. And that just needs to be appreciated. As we know in the world today, over 2 million people have died of COVID. In Canada, over 18,000 deaths. And in British Columbia, we've now gone over the 1,000 mark for fatalities in this province. That's not insignificant at all. Right.
And so another question that we have is kind of more related to the rollout or the distribution of the vaccine. Grace Duncan is wondering, when is it coming to PG? And perhaps this is more of a question for Beverly.
So I'll just start in that the vaccine has already been slowly rolling out in Prince George and a few other of the major communities in the north. So for example, some of our long-term care facilities and workers have been getting the vaccine. And it's also being distributed in some of our First Nations communities in the north as well. But we know that there is, you know, a good plan to get it to everyone, you know, those that are really high need for it. Like Dr. John said, there's a lot of people that we know are more likely to be sick and die from COVID. We want to get it to them as soon as possible. The logistics of distributing these vaccines are extremely difficult. And so that's why there might just be some, we have to plan very carefully on how we can get it to everyone. So we can't get it to everyone today or tomorrow or in the next month, but we're doing our best to get it, to have a plan to get it to everyone who needs it.
Okay. And kind of another question we have here is, how does it work for on and off reserve people that belong to certain communities?
That's a, oh.
Yeah, absolutely.
Yeah.
Maybe I can jump in on that one. Okay, so with First Nations Health Authority and Northern Health together, we've been working collaboratively to really make a good plan, looking at key factors on which communities would be priority, and because of various different factors and distance and healthcare accessible to them. And on reserve, as we know, is a priority because of higher, lower access to higher levels of care. And so the on-reserve numbers taking into account for, and off-reserve also will be taken into account for by Northern Health.
Okay, and that kind of leads into another question of mine, that the people that belong to a certain community, if a vaccine is being distributed in, let's say, Notlay, but someone lives in Prince George that belongs to Notlay, can they travel to Notlay to get that vaccine?
We really discourage that, and we don't want to see that happening because the doses are so few right now, and we are focusing with the on reserve population. So as I just kind of think a little bit that the on reserve, there is known a little bit higher risk, and so we want to focus on reserve. And the people who live off reserve will have a chance.
Okay.
As well later.
Another question around the distribution of the vaccine. Why are some communities getting everybody over 18 vaccinated right now, and others are just focusing on 65 years and older?
That really was focused around the proximity or how close you are to a higher level of care. So those communities who are very remote, it takes a lot more effort and a lot longer to get patients out who are very ill or who could become very ill if they were to get infected with COVID-19. So those communities that are remote, being like generally more than an hour away from a hospital, those ones we are really strategically looking at 18 and over. But the communities that are closer to a hospital, those ones would be 65 plus, or possibly right now, because we have even less vaccine available right now with Pfizer changes, 80 plus. But more will be coming, and then we will be getting it out.
And what is the plan around the second shot or second dosage? And what is the time period between your dosages?
So right now, my understanding is that there is evidence and support for delaying the second dose up to 35 days. We do know that it's important to make sure that we abide by a minimum dosing schedule. So I mean, a vaccine has to have a minimum amount of time that it can be given apart from each other. And I think in the COVID vaccine, it's a minimum of 20 days. And that's the most important thing. The maximum time between the two doses, we believe matters less, because we know that the first dose gives a really good response. It's about 90% effective after the first dose. So just knowing that there's all these logistical challenges with the vaccine, and right now we know that Pfizer isn't sending as much vaccine. You know, we want to try to be mindful to get as many first doses into arms to try to protect as many people as possible. And that might mean delaying the second dose in some people, but there's no reason to believe it isn't okay to delay it just a bit.
Okay. And that kind of goes into another question of ours, that why is the Moderna vaccine getting distributed more to the First Nations communities than Pfizer?
Yeah, I can answer that as well, Jordan, if that's okay. It's ease of transport and use. So the two vaccines can be require a little bit different handling, and that's in terms of the temperatures of which they have to be kept in a freezer. And the Pfizer has to be kept at a much colder temperature that requires a different type of equipment that is a lot harder to find, truthfully. Both vaccines are excellent. Both are of similar efficacy, we call it in healthcare, but how they're transported and kept cold is just a little bit different. Some of the vaccines that are going to be coming out in the future are going to also be a little bit different, which may help even more vaccines get to more remote places in an easier way.
Wonderful. And another question that we have, that some people have been seeing some misconceptions, especially around social media, that or rumors that the vaccine it has nanotechnology in it that allows the government to track people and such things like that. Is there any evidence behind that?
So I just want to be clear, because I know we're getting short on time.
Yeah.
So the vaccine doesn't have any computer chips in it. It doesn't do anything even remotely like that in any way. So that's just bunk, for the record. The vaccine does not give you COVID. COVID's not in the vaccine. So you will not get COVID from the vaccine. So I just really want to underscore the importance of the vaccine helping us to essentially cure this pandemic. There's only two ways out of this pandemic for all of us, and and immunity is the common thread, and either that's through natural immunity or the vaccine. The vaccine is, if you get COVID, as I said, depending who you are, there's great risk to your health and even death. People on the call today, and I really appreciate the comments in the chat room. There are people who know people have died, family members have died. Nobody has died in the trials with who got the vaccine. So we must do this as a team, as a group. If we look at TACLA, we recently went to TACLA the end of December, 199 successful vaccinations out of 200. One vaccination was spoiled. TACLA essentially has herd immunity at this point. So that means that the population that's been vaccinated helps protect anybody who has not. And that's the way we stop human-to-human transmission. That's the way we stop the virus from mutating and developing different genetic ways of being, and we hear about that on the news. So I just implore everybody, we need to get vaccinated, myself included, all of you. It's a safe vaccine, and it's the way out of this pandemic with certainty. And I just again really want to thank everybody for the questions, and I know Norman's asking a whole bunch. Hi, Norman. And I'm happy to chat with people offline and ask, answer their specific questions. But all of you, please connect with your healthcare teams and your respective doctors and nurses and nurse practitioners, and whoever's in your area. They'll answer all your questions for sure.
Wonderful, thank you, Dr. John. And I know a few of you have to get running now, so feel free to duck out. I just want to give Trish an opportunity to add her input, because I know her power went out. So if you're in Prince George, you know that there's a big windstorm right now. So see you later, Dr. John. Thank you so much for joining us. And Rakel, do you have to go as well?
I do. Thanks so much. I just, just want to thank Dr. John for those comments. I think it's so important. I just wanted to reflect to everyone that on the weekend, I got an email from a colleague telling us that her grandfather in one of our northern First Nation communities got his vaccine over the weekend, and I cried at that. It's just so important, and it's absolutely what we can do to protect ourselves, protect our families, and protect our communities, and try to end this pandemic. So yeah, just it's so important. This is a safe vaccine, and like Dr. John said, this is our way out.
Absolutely. Wonderful. Okay, thank you so much for joining. And I can fit on the screen now. I can add my video. There we are. So yeah, Trish, I don't know how much you caught when your power went out, but I know a lot of your area is about just like the distribution of the vaccine. Is that correct?
Yeah, that's what we're working with. Can you hear me?
Yeah. Oh yeah, we can hear you.
Okay. Yeah, so we're working on the rollout. And I know there was a number of questions that you had in there, 65 plus, 85 plus, 18 plus, all of those questions. And I think it might be helpful to note that there will be some messaging coming out, I believe, in the next 24 hours. Is my understanding that we're working on a message with Northern Health to ensure that this information is updated and readily available.
Okay.
I know the one question that I keep hearing is the on reserve and the off reserve. So the numbers of vaccines that FNHA has been given are dedicated for those that are actually on reserve. The off reserve population, we're working in close partnership with Northern Health to ensure that they are caught as well. So they're not going to be falling through the cracks. It's just, it's going to depend on the number of vaccines that are available and the areas that, and we're trying to really align closely and sequence with them so that we can ensure that, when the communities around Burns Lake are being vaccinated, that the vaccines are also happening in Burns Lake in the local municipalities as well. Now, I know that there's questions because sometimes Northern Health is doing 80 and over and FNHA is doing 65 plus. And those are some of the things that we're trying to work out given the limited number of vaccines that we are working with. So I'm not sure, Bev, if you have anything to add.
No, yeah, we had discussed that a little bit as you were
Okay.
away. So, but that goes what I was saying.
Okay, perfect. Sorry about repeating, but like I said, my power went out, but I'd be more than willing to answer any of those questions, Jordan. If you send them into our team, we can definitely get that out so that there's some updated information for you all.
Wonderful. And I don't know if this is kind of a ambiguous question, but it's one that I've seen pop up once in a while. Of when will all BC get the vaccine? Basically, and I know that's not really a question that can be nailed down to a date, but maybe just a better idea.
I think that if we look at what Justin Trudeau has been saying, is that he anticipates all of Canada will be done by September. So I don't know if things have changed from what I've heard as of late. I just know that we'll be sequencing out when we do receive the vaccines and go from there. But I haven't heard anything other than that. Bev, I'm not sure if you have.
No, I don't have any further information, but I would suggest the fall would be an appropriate, reasonable time frame. Maybe even a little bit later.
Okay. So I know everyone's busy and we got to get back to our duties. Is there anything else that you wanted to add?
No, I'm great. Just like I said, if you have questions, we'll be more than willing to answer them via email, or if this is helpful, we can do another one.
Yeah, absolutely. And like I mentioned before, you can also send your questions to communications@csfs.org, and we will get your questions either to the professionals or we can answer them to our best ability. And so if you had missed perhaps maybe a question that we answered earlier in this live stream, we will be posting this later as well. In its whole entirety, so you can see every second that you might have missed, and we'll be posting this on Facebook and YouTube, so it'll be widely available. And yeah, I thank both Bev and Trish for joining us today, and both the doctors that had to duck out as well. So thank you very much for joining us, and again, and thanks to everybody that joined us on the live stream as well. Again, email to communications@csfs.org. I see Marlena put it in the chat there. And again, thank you to CSFS First Nation for helping us putting this together, as well as FNHA and Northern Health. Thank you, everybody, and see you. Have a great day.
Thank you.